Hi, my name is Melinda Martin and I'm a physiotherapist at MQ Health. So today in this wellness series I'm going to be talking about bone health. So why is bone health important? So our bones are here to provide the frame to our body. They house and protect all of our important internal organs such as our brain, our heart, our lungs and our spinal cord. They are also used as attachment sites for all our ligaments, tendons and muscles, and they articulate to create our joints. Therefore, they are fundamental structures that allow for movement and for us to function. Bones also serve to store and release minerals such as calcium, phosphate and magnesium that are vital to the functioning of other life-sustaining systems in our body. And within our bones, we have red bone marrow where our red blood cells are formed. We also have yellow bone marrow, which acts as a storage reserve for the body by housing triglycerides, which is also known as fat or lipids within our blood. So as we age, our bone mass and mineral density within our bones will often start to decrease, thus weakening the bones. If this is significant enough, a person might be diagnosed with osteopenia or osteoporosis. Osteoporosis is classified as a bone disease that develops when the bone mineral density and bone mass decrease to a certain level, creating changes to the structure and strength of the bone, leading to fragility, and osteopenia is often the level before osteoporosis. So if you have poor bone health, you're much more likely to sustain debilitating fractures from simple tasks such as bending over, small falls, or even sneezing. Osteoporosis can be a silent disease because people will often not have symptoms until a fracture does occur. And the gold standard way for people to check on their bone health is by getting a bone density scan using a special type of X-ray called a dual energy X-ray, also known as a DEXA scan, which you can see on the screen here. And you would need a referral from your doctor to get one of these, and it is often how osteoporosis is diagnosed. So these fractures that occur from poor bone health need to be taken seriously, as it's not like when you're young and you break a bone and you recover within 4 to 6 weeks. These fractures can take a lot longer to heal, and they can result in disability, diminished function, loss of independence, and even premature death. For example, hip fractures are associated with an increased risk of mortality within the first year after them occurring. Vertebral or spinal fractures can be just as scary, with symptoms often including severe back pain, chronic pain, loss of height, or spinal malformations such as having a stooped or hunched posture, with the inability to stand up tall. People with poor bone health may also become isolated and depressed from a fear of falls and even from the pain of fractures. So with this information in mind, it's probably no surprise to you that fractures often precipitate a downward spiral in physical and mental health. And this dramatically impairs quality and length of life, therefore highlighting the importance of maintaining good bone health as we age. So what can we do about it? So bone diseases such as osteoporosis will often not come about until later in life, but it's important to be thinking about bone health even from a young age in order to prevent this from occurring. So we can build up the density and strength of our bones when we're young through physical activity, so that as we age we have a stronger starting point from when the natural decreases start to occur, which you can see on the graph usually begin around the age of 30. So something else to consider is ensuring an adequate intake of vitamins and minerals, as this is essential for optimum bone formation and ongoing bone health. Two of the most important are calcium and vitamin D, but many others are needed to keep bones strong and healthy, and if you're not getting enough of these in your diet, your GP or your dietitian can help you to manage this. So on the other hand, low levels of physical activity and prolonged periods of inactivity can contribute to an increased rate of bone loss as we age. Therefore, the most important thing that we can do for our bones is to keep active. So physical activity is important in maintaining or increasing bone mineral density and the overall quality and strength of our bones. And this is because osteoblasts, the cell that create new bones, are stimulated by load-bearing exercises. And so the bones subject to these mechanical stresses undergo a higher rate of what we call bone remodeling, where the new bone is formed, therefore making them stronger with increased density. And on the other hand, the reduced skeletal loading is associated with increased risk of developing osteoporosis. And so what exercise should we be doing for our bones? So a lot of evidence supports weight-bearing exercise such as jogging, skipping, stepping, climbing, high-intensity aerobics, and playing various sports where bones are being loaded. This is proven to limit the decline in bone mineral density and in some cases even increase bone mineral density, and therefore including some form of weight-bearing exercise into your daily or weekly routine is recommended. If walking is your chosen activity, however, it is important to know that on its own, it is a great form of exercise with many health benefits, but it's often not enough to impact the decline of bone mineral density. So therefore, this does need to be supplemented or alternated with another form of exercise. A perfect way to supplement your daily walking would be strength training. So not only does strength training have endless amounts of benefits, it has been proven to effectively increase bone mineral density when done at a relatively high intensity. Now this means that training with high load and low repetition will get you the best results. It is recommended to aim for about 8 to 10 repetitions, 2 to 3 sets 3 times a week. You want your workouts to go for about 45 to 70 minutes, and this will allow you to do 6 to 7 exercises per session. Now, if this does sound like a lot, just remember something is always better than nothing, and you can start small doing about 30 minutes of exercise a week, and then you can work your way up to it. And if you're not sure how to get started or how to put this into your weekly routine, you can talk to an EP or a physio if you need. So some examples of the types of exercises that we'd be able to do to increase bone mineral density. You can see some of them on the screen here, but weighted squats, leg press, hip extension, hip abduction, adduction, stair climbing with weighted vests, shoulder press, pull down, seated row, bench press, and any strengthening of your back muscles, which will help increase the strength of your back and the mineral density in your spine and therefore reduce spinal fractures. So in summary, choosing to engage in regular physical activity and to follow a bone healthy diet and to avoid behaviours that can damage bone, such as smoking and drinking, can allow individuals to improve their bone health throughout their lifespan. If you're unsure on how to best manage your bone health, your healthcare professional can help you in decision making and management of this. So this brings us to the end again, and I hope that this was helpful, and thank you for listening.